Hi everyone, Dinesh Sirasena here, and today we're going to be talking about scanning or imaging the lateral elbow. As with previous talks, I really recommend the ESSR guidelines on musculoskeletal imaging. These are very concise and clear and have good images in terms of how to scan and position the patient. The other resource that I would fully recommend is ultrasoundcases.info. This has lots of typical examples of MSK pathologies that you might find on ultrasound imaging. So here are the images from the ESSR guidelines for elbow scanning. When moving from proximal to distal, you'll see the lateral epicondyle, the common extensor origin. You'll see the radial collateral ligament sitting over the lateral joint line. And finally, you'll see the radial head. If you turn the transducer into a short axis orientation over the radial head, you'll see a hypoechogenic line sitting over the top. This represents the cartilage sitting over the bone. If we look a little bit more closely at the joint line itself, you can see the lateral epicondyle, you can see the common extensor origin, and you can see the radial head in more detail as well. Typically, when I'm scanning a patient for the lateral epicondyle, I'll either have them sitting down with their elbow resting on the examination couch, or for more stability and greater comfort for the patient, I may have them lying in a supine position with the hand resting against their thigh and the elbow slightly flexed. This exposes the lateral aspect of the elbow really nicely and also is more comfortable for the patient, and there's also more stability for you when you're doing the imaging. Here's a typical example of a lateral elbow scan. So, as previously, we have the lateral epicondyle, we have the common extensor origin, we have the lateral collateral ligament sitting over the lateral joint line, and then we have the radius more distal to it. Here are some examples of lateral epicondylitis. On the top image, you can see there's hypoechogenic changes through the common extensor origin with calcific changes which may represent previous micro tears. When the power Doppler is applied, you can see there's increased vascularity in this area. And so it's really important when you are scanning and assessing for lateral epicondylitis to remember to put the power Doppler on to see if there's acute inflammation at the time. Here's an example of a radial collateral ligament injury. As you can see over the lateral joint line, there are hypoechogenic changes, which represents edema or maybe even a disruption of the radial collateral ligament. Again, even though it's a radial collateral ligament injury, it's important to apply the power Doppler to make sure that there isn't any acute inflammation going on. Thanks for watching. I hope you found the video useful and it adds to your knowledge of musculoskeletal ultrasound and how you can use it in your clinical practice. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can also follow me on Twitter and Instagram. And remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you all very soon.